So you've already met the team, and feel free to reach out to them anytime you have questions. All right, so I know that not all of the coordinators are here. Many of you are sitting in for your coordinators. So I thought it was worthwhile going through some of the basics about NAHMS studies, right? So every single study we do is developed in collaboration with the industries. We would not be doing NAHMS studies if it wasn't for the support, the collaboration, and the input from the industries. Every study collects animal health data. All of our studies are nationally representative. They're voluntary, which means every producer can choose to answer whatever question they want, choose not to answer whatever question they want, okay? And all of their responses are confidential. All of our studies are statistically based for population estimation. Excuse me. So what that means is that producers who want to be in the study, who call you and say, I want to be in the NAHMS study, we can't let them. So producers are selected from the NAHMS list frame. It is meant to be representative of the industry. If we accepted producers who wanted to be in the study, we would bias the results. Every producer that gets turned over is important. Each producer represents 5, 10, 20, 30 other producers. So each producer we lose the results for all of those producers. So every producer is important. So we have worked with goats before. We did the goat 2009 study. We also did a goat death loss study about 3 years ago. In 2009, we were not able to do a phase 2, which means we did not include the field. All we did, we worked with NAHMS. We got baseline results for the goat industry. In 2015, we worked with NAHMS to do a goat death loss study, so we better understand causes of loss in the goat industry, both predator as well as non-predator losses. Right, so each of our studies starts with a needs assessment phase, and that means we go out and we try to find, what is the information, what are the information gaps, what can a NAHMS study do? And we meet with producers, we meet with industry, we work with universities and researchers. So in 2017, we did a NAHMS needs assessment survey. How many of you responded to the needs assessment survey? 1, 2. How many of you responded to the swine 2020 survey? How about the antimicrobial use survey? Right, so that's great, but it shows us that we need to do more outreach because we would like to get your input for our surveys. All right, so the needs assessment for the goat study, we did it in August, September 2017. We did get over 1,200 responses from 50 states, 3 different countries. And we got responses from producers, the goat industry, government, animal health professionals, so veterinarians. And the only way that we were able to get such a good response rate was through the support of the American Goat Federation, the American Dairy Goat Association, and USAHA. The respondents, so the vast majority were goat producers, but we also heard from veterinarians as well as researchers and university employees. And of the goat producers, we heard from the meat goat producers, the dairy goat, and the fiber producers. Now, if you look at that, the dairy goat industry represents a very small percentage of the goat industry, and yet over 30% of our responses were from the dairy goat industry. They were super excited about this study. So we asked about their top management concerns, and the top management concern for the goat industry is the approved or the lack of approved pharmaceuticals and vaccines. Second was the doe management and health, nutrition and feed, infectious diseases. So we take these responses and we develop our questionnaires based on the needs assessment. We asked about their top disease priorities. The number one disease priority are internal parasites, and that isn't surprising. So in 2015, we asked about death loss, and the number one cause of death loss, non-predator death loss, for the goat industry is parasites. In fact, in 2015, over 80,000 kids and goats were lost due to internal parasites. And the sad thing is, we've got researchers in the United States that need to go to England to get data on the cost of controlling parasites, because we do not have the information in the United States. So we're working with CSU as part of the study to try and capture some of those costs for the industry. If we get that information, it leads to research money, leads to grants, it leads to pharmaceutical companies knowing that this is important. One of the things that we also ask about is incentives. What is going to incentivize the goat producers to be in the study? 90% of the responses indicated parasites and resistance were an important factor for them. 68% of the responses indicated that other disease agents would be important for them. All right, so every time we do a NAHMS study, we we include at least as many states as it takes to, I lost the microphone. All right, at least, sorry, I've got a really not a good voice for projecting. Anyway, so we always try to include at least 70%, well, we always include all the states that represent at least 70% of the goat operations and the goat producers. So for the goat industry, we've got 25 states that are in the study. And they represent 83% of US goats, 78% of the US goat farms. Now, we've included Alaska, not because Alaska has a lot of goats, but because the state of Alaska, Jody up there is smiling. Right, but the state of Alaska requested to be in the study because they've got issues with pneumonia. And they are working with their domestic producers, trying to understand transmission issues between the domestic sheep and goats and the bighorns and the Dall sheep. And they want to know more about their goat producers. So Alaska's in the study. We also were requested by Vermont and Connecticut to be in the study. They have a lot of dairy goat operations. And although they are small states, so they are not often included in our studies, the concentration of the number of states, the concentration of the number of farms in each of those states was such that we were able to include them in the study. So I was going to ask if anybody was here from a state that was in gray, because they are not in the study. I guess Avery.
I have a Colorado.
Yeah, we go.
Too, so
right. All right. Thanks.
In the spot, Colorado.
Right. So thanks, Avery. Yeah. All right. And we know some of these states we know some of you don't have the resources to get all of the producers that are going to be participating in this study. So we have set aside some travel funds to go out, send our NAHMS folks out there to collect samples and data from some of the operations, specifically in Texas and Oklahoma. But if any other states think that they're going to have a problem, please let us know. And Alaska is collecting all of their own samples. They're not using NAHMS. And I know, Jody, you're going to be involved, right? Yeah. All right. So the dairy goat industry does not make up a very large percentage of the goat industry. But we feel like because there are so many changes in the dairy goat industry in terms of increasing farms, an increasing number of animals per farm. I think those of you in Wisconsin, Iowa, maybe California, you're seeing thousands of goats per operation in very close confinement. That represents a change in transmission risk. So disease risk is much higher in those operations. So we felt like it was important enough for us to oversample the dairy operations so that we would get enough dairy operations to represent the United States dairy goat industry. All right, so based on the needs assessment, based on working with the industries, talking with universities, researchers, we've developed these study objectives. One of them is to describe the changes in the industry in animal health, nutrition, management practices between 2009 and 2019. So, no surprise, we're going to be looking at practices that producers use to control the internal parasites and reduce anthelmintic resistance. We have, over the next few days, we're going to be covering some of the questionnaires. We've got a pretty big section of the questionnaire devoted to parasites, parasite control, cost of parasite control, and this is why. Okay, we're going to be looking at antimicrobial stewardship, antimicrobial resistance practices. CDFA has been partnering with us to develop these questions, make sure we're collecting the information that we can on antimicrobial use. It's really important for every single livestock industry. We are also going to be describing the management practices associated with economically important diseases. So what are those? Well, we know that CAE is economically important. Caseous lymphadenitis is important. Mycoplasma of pneumonia. So you will see in our questionnaires questions associated with disease risk, management that reduces disease risk for those diseases. And then finally, you will be collecting blood samples, sera, whole blood, so that we can develop a serologic bank and a DNA bank for the goat industry. So most NAHMS studies collect blood samples that we put into a serum bank that's at NBSL. So in sheep 2011, we had 4 aliquots that were collected and stored at NBSL. I think 2 or 3 of those have been used, looking at OPP, as well as Mycoplasma ovis. So researchers down the road may decide that they need these sera to use for future studies, and that's why we collect them. So I mentioned M of pneumonia. This was a late request. It's a big deal for sheep and goat producers, especially in the West. Many of these producers have lost their grazing rights because of concerns about disease transmission between the sheep and goat operations, domestic, and the wildlife. So in 2011, we looked at MO pneumonia. And while, we've learned a few things from it, most producers do not recognize it as an economic cause of loss for them. But we found in 2011 that it really is. There was interest from ARS as well as the industry, the goat industry, to look at it in this study. CDC requested that we also look at Coxiella, which is Q fever in people. There are a variety of strains of Coxiella present in the United States. Goat strains tend to be more easily transmitted to people. Not all goat strains, but some. So what is the prevalence of these strains in the United States? Where are they? So we'll be collecting vaginal swabs as well as blood samples and using the results of those tests to look at the association between shedding, antibody positive, abortion, and then looking at the strain types in the goat operations in the US. All right, so tomorrow we'll be having group sessions where we go through these questionnaires. So we've got the VS questionnaire, we've got the dairy questionnaire, and then we've got this agritourism questionnaire. And you might be wondering, why are we adding another questionnaire? Agritourism for many goat operations is a way of supplementing their income, especially in the East. It's a way of sharing their love for goats with the community. And many of these operations, well, first of all, we don't know how many of these operations there are. And then for those operations, how many of them truly understand their risk for inviting the public onto their operation. Some of these operations have had the public visit, have had people get sick, have been sued, have lost their operation. So this questionnaire asks people about, do you have hand washing stations? Do you prevent the public from touching the goats? Sometimes just asking these questions will start the conversation so that producers better understand their risks. They understand the risks, they can mitigate the risk. So we'll be going over that questionnaire as well. All right, so biologic samples. The samples that will be included in the study are fecal samples. We'll be testing those for parasites, as well as enteric pathogens. We'll be collecting blood samples. The sheep industry has had the benefit of genetically resistant sheep genotypes that are genetically resistant. They can help them manage scrapie risk on their operation. The goat industry has not had that ability till recently. So in the last few years, they've identified genotypes that appear to be resistant to scrapie. So knowing the prevalence of those genotypes across the United States in the various breeds in the United States can help producers, can help VS, in knowing whether or not going with the genetic resistance will help reduce scrapie in the goat industry in the US. Nasal swabs for MO pneumonia, we spoke about that, and then vaginal swabs for Coxiella. Right, phase 1. So data collection has already started July 1st. That's NAHMS. They'll be going out from July 1st through August the 9th. They'll be administering the goat questionnaire, the general management goat questionnaire. Phase 2, that's the phase that you'll be involved with. That starts in September. So between August 9th and early September, NAHMS will be turning over names, and we'll be covering that later today. Data collection initially was scheduled for September through December, but because of V&D, everybody rotating out there, as well as TB testing, we've decided to extend data collection. But really, if it's possible, we would love to have those goat operations visited in the fall. And if you can't get to it, then we've extended that data collection period. Data collection is going to be targeted at health and disease. And then there's biologic sampling. So, as a reminder, the study materials are available on the web. That's a very long URL, so hopefully you've already got access to that. If you don't, we can email it to you. What we really want to do is make sure that you've got the materials that you need to go out there and visit with producers, go to industry meetings, and not only promote the study, but when it's over, promote the results. And I know NAHMS has not always done that in the past, but it's our goal to give you those PowerPoints, to give you what you need to meet with producers, share the results. So as with any study, I mean, we wouldn't be able to do these studies without the input of a whole variety of researchers, industry groups, states, actually goat producers in Colorado. We pre-tested all of the questionnaires on many goat operations in northern Colorado as well as Buena Vista. So thanks very much to all of you, North Carolina State University, American Goat Federation. You'll be hearing from many of these people over the next few days. And then, of course, as Amy said, thanks to all of you, because we would not be able to get the results that we need for this study without you and the rest of the field force. So if anybody has any questions, happy to answer them. Otherwise, I think, are we going to have Chuck? All right. So normally what we would like to do in this 2.5-day session is talk to you about previous studies as well as future studies. Typically that would be tomorrow. Chuck is going to be out tomorrow. Chuck is our beef commodity specialist. He was the study lead for the cow-calf 2017 study. So he's going to come on up and he's going to share with you some of what's going on with the beef 2017 study, so you know that your hard work. How many of you worked on the 2017 study? Okay, so maybe you're wondering where those results are, what we've been doing, what happened to the data you collected. Chuck is going to explain some of that. And thanks very much.